Good morning from Austin, Texas at the Combined Ophthalmic Symposium. We're pleased to have again with us today Dr. Nate Radcliffe. Good morning, Nate. Thanks for being with us.
Good morning, John. Great to be here.
Nate, I know that when we spoke previously on the program, we focused a lot on surgical intervention in glaucoma. But I'd like to shift gears for a moment and query you this morning about medical management, because oftentimes that is the majority of our treatment, and oftentimes that is what predates surgical or preempts surgical treatment, if you will. Tell us a little bit about your perspective on medical management in glaucoma.
Yeah, so as much as we all love to talk about doing glaucoma surgery, using lasers, the bread and butter of managing glaucoma is still pharmacotherapy. And it's actually been really kind of exciting and dynamic these past few years. We have two products that increase outflow, so that they're kind of surgically thought out glaucoma medications. Those are latanoprostene Bunode or Vyzulta, as well as Notarsadil, which is Ropress or Rocklatan with latanoprost. They probably lower episcleral venous and they help trabecular outflow, so that's kind of interesting. At the same time, we have other interesting things happening. Dorzolamide is scarce, and it's a manufacturing shortage from a number of different manufacturers. And that's a problem for patients because they run out of the drop at the pharmacy, and frankly, they lose control of their glaucoma. I've been shying away from that drug until we have a really reliable supply. We still don't know why it's not around. It does kind of highlight the value of brand name products, though, because using brand name products, the companies are always responsive. They explain where their product is.
Yeah, Nate, I wanted to go back on and dig into something that you mentioned about latanoprostene or Vyzulta. How does this differ from the existing prostaglandins that are on the market that are available generically?
Well, it's interesting because we don't really have anything quite like it. It is latanoprost, and it's a higher concentration latanoprost, but it has this Bunode modification. So when it hits the surface of the eye, it releases nitric oxide. And nitric oxide does all sorts of things throughout the body. It relaxes smooth muscle, but in the eye, it relaxes the trabecular meshwork. And possibly some animal data that suggests it could also change the vasculature in the episcleral system, lower the pressure there. So that's interesting because now we've got dual outflow from one molecule. So we're increasing uveoscleral outflow and lowering the trabecular resistance as well.
So where would a medication like that, Nate, fit into your treatment paradigm? Is it something where if patients are perhaps not able to get dorzolamide, like you mentioned, is that a reasonable time to consider switching over? Yeah,
and it's probably even earlier than that in the treatment paradigm. It's a primary therapy for sure. It does have latanoprost tolerability, which is a first-line therapy to be sure, with slightly better efficacy than latanoprost. They showed in their phase 2 study. Now, it's a newer drug, so you can have some trouble getting approval. And I've had some success with specialty pharmacies. And this is for any drug that you want to prescribe that you're worried, well, this is brand name, it may not be covered. Specialty pharmacies will do the prior authorization for you. They'll take some of that out of your office, or at least they'll help with the prior authorization. They may need records, they may not need them in some cases. So I've been using specialty pharmacies with Vyzulta or any other medication I'm having trouble getting access to sort of bolster my ability to prescribe brand name drugs that I think the patient will benefit from. And that has opened up some doors. It's allowed me to treat glaucoma a little bit more the way I want to, rather than sort of being reactive to whatever the coverage tells me to do.
So it sounds like the Vyzulta that you mentioned has that extra ability with the nitric oxide to potentially lower pressure even further as compared to traditional prostaglandins.
Yeah, in their phase 2 study, they had a 1.25 millimeters better efficacy than latanoprost. Still not entirely clear exactly how it would stack up against all the other PGAs, but being that much better than latanoprost is certainly a feather in the molecule's cap.
Nate, this has been a great discussion. Thank you so much for sharing your expertise on medical management of glaucoma.
Thanks, John.